Welcome to this month's Friends You Keep. As they say, we're the average of the 5 people we spend the most time with. And at Erin Wellness, we believe that sustainable health and wellness is an accumulation of 5 pillars: the thoughts you think, the friends you keep, daily movement, nutrition, and lastly, supplementation. So each month we feature guests doing exceptional things that hopefully will inspire you to step into all you are destined to be. All right, welcome to this month's Friends You Keep. I am delighted to welcome Dr. Pawa. Welcome.
Thank you, Erin. Happy to be here.
Thank you so much for coming on. Dr. Pawa has over 30 years of experience specializing in women's health and integrative medicine with a deep focus on hormones, menopause, and the mind-body connection. She's certified in mind-body medicine through the Harvard Medical School, is a certified menopause clinician, co-founder of the West Coast Women's Clinic, and has advanced training in functional medicine. She's also a clinical instructor at UBC's Faculty of Medicine, mentoring future physicians, which we know this is so important. So I commend you on that one. And is a passionate advocate for evidence-based, women-centered care. Her TEDx talk, I did not know this about you, has over 1 million views. That is so impressive. And her best-selling book, The Mind-Body Cure, has been translated into 5 languages. Her upcoming book, Ovaries, the Owner's Manual, which I will be grabbing a copy, will be available later this year. So welcome. Thank you so much for taking the time out of your busy schedule.
It's a pleasure, Erin. I'm always happy to take an opportunity to inform and educate and empower women and men too, actually.
Yes,
All listeners.
I've been lucky enough to be on the receiving end of your talks on several of them, and I love listening to you speak. You are a fantastic speaker, and there's just so much knowledge. And I think you can, I think I know a lot sometimes, and I walk away going, oh my gosh, there's some really great nuggets here. So thank you so much for all that you do. And so for listeners who may be new to you, can you share a little bit about your journey into medicine and what led you to specialize in women's care?
Sure. I actually went into this foray of healthcare as a pharmacist. I was a pharmacist, worked as a pharmacist, and dispensed medication. And then I felt this calling that I just needed more. I wanted to be more involved with patients, and I went into medical school. And of course, it was a big focus on women's health because I was doing a lot of deliveries and obstetrics and, the whole gamut from puberty to menopause, even back then. But I didn't have the education I have now. So looking back, I wish I knew then what I know now. But life is a journey, and everything happens for a reason. And I had a terrible car accident, which you probably learned from my TED Talk. But that, even though it was horrific and horrible to go through, it was what created that impetus for me to go back and say, wait a minute, what happened to patient-centered care? What happened to looking at the body as a whole? And this is where I went back to Harvard Medical School in the behavioral medicine program, learned a lot about the nervous system. And then when you learn about the nervous system, it's all about hormones, right? Cortisol is your stress hormone. And
Yeah.
then I went down the rabbit hole and said, well, cortisol affects your ovaries. And how come we don't talk about this? And so then it kind of got to a point that I said, I can no longer just write prescriptions. I've been a pharmacist, I've filled prescriptions. As a doctor, I've written prescriptions. But really, the true prescription is when you empower patients to look at their internal pharmacy and teach them how to keep their body whole and working as a unit and going
Yeah.
back to the root cause. So that's when I started the clinic with a like-minded physician, Nishi. And we both started this clinic in 2002. Scary
Wow.
time. It was
Yeah.
when the WHI report had come.
Yeah.
Yeah. And here we are 25 years later, and our sort of the unique offering was that we look at women not just for estrogen, progesterone. We say, well, what about the body as a whole? Look at their nervous system, look at all of it.
hmm
And then that's how West Coast Women's Clinic came to be and still is.
And back in 2002, when you think about the Women's Health Initiative study, and so many women are pulled off of HRT, were you prescribing HRT when you saw a needed fit, or were you also because they had told everybody kind of stop, right? So,
Well, here's the thing, and this is
mhm,
where, life everything happens for a reason.
yeah.
I'm a pharmacist, and as a pharmacist, I knew that when you take estrogen orally, it has to go through the liver. And when you take estrogen orally, whether it's hormone replacement or birth control pills, they make certain proteins in your blood that thicken your blood and put you at a higher risk for blood clots. So
Mhm.
even when we started the clinic, we had already decided we were only going to use estrogen that was natural to the human body, number one,
Okay.
and we were only going to use it through the skin where possible. And progesterone, of course, we use the natural. So that report that came out that was so damaging, they were using oral Premarin, which is
Yes.
estrogen from the horse,
Yeah.
and they were using Provera, which is a synthetic progestin. So it wasn't the same stuff. And we were very clear that we had to do an individual risk assessment on
Yeah.
that patient and go through the skin. And that 25 years later is now the standard. So it feels really
Yeah.
great.
You're the one that
Yeah.
started it. You could take the credit.
So,
Well,
well,
I was
go
gonna say
ahead.
my mom had a really great gynecologist back in the day. When my mom was 49, she had a really tough menopause. And that doctor prescribed her estrogen and progesterone. She's been on it ever since. She's 75 and she's thriving. And it's interesting to see. She even did develop osteoporosis, even still being on it. So she
Oh,
has very, I do a lot of jump training and lift a lot of weight. So I've got good bone density. But
yeah.
looking at that, I talk about her doctor being just like, no, stay on it. And even when the studies came out, she went in, the doctor's like, no, stay on it. Trust me, this is okay. So you look at these women
Good for
doctors, and
her.
it was a woman
Yeah.
gynecologist. And my mom said she recently just retired. My mom was devastated. And my mom asked me, she's like, do you think I should go off it? And I'm like, no, why would you go off? Stay on till you die. Really?
This is now the current guideline because we've been like
Yeah.
watching this pendulum swing back and forth, and the past, present, and future, where are we going with it? Because the past was get off the hormones, 2002. They're bad,
Mhm.
they're bad, they're full of like breast cancer and blood clots, and you're going to be in trouble. And now the pendulum's over here saying everybody go on hormones. Don't miss this opportunity, be on hormones. And we did not swing with the pendulum. We always said patient-centered care, evidence-based
Yeah.
care, which is what I know that you appreciate also for
Oh,
women
yeah.
in their reproductive years.
100%.
Yeah, and for your mom, maybe she has low risks and high benefits, so she should just
Yeah.
continue. Yeah.
Well, and even, you know, my big thing is for women to advocate for themselves. Like I did a talk last
Mhm.
night at Nature's Fair out in White Rock, and I speak about, finding a practitioner to work with and being educated on what works for you, like what
Yeah.
sits well for you. And, I'm very honest with them. I tell them I'm taking progesterone, with a lot of them are like, oh, they're like, oh, because the natural health seems to be we're like, we're good. And,
Yeah.
pharmaceuticals aren't good. Where they're saying, I'm like, no, because I believe this is what works for me. I said in doing this and talking to women, it's about educating them, about going in and being educated, having a conversation with your doctor, and then stepping back and saying, what do I want to do? Right. But as long as we have the education, that's what I think is so desperately needed.
And that's the thing, Erin. It's supposed to be for informed consent and informed
Hmm.
care and shared decision making. So, as a patient, as your listeners, if they're well informed, they're going to make better choices for their health and being
100%.
educated with credible sources. So, I'm so glad that, you have this platform to provide hopefully credible education to everyone. And I think that's what's going to help women is for them to advocate for themselves
Yeah.
through education awareness.
I
Yeah.
agree. So many women, and I know you hear this all the time, I don't feel like myself, right? They come in and like, I just don't feel like myself anymore. When women come in saying that, what is one of the first things you really look at? Is it cortisol and stress? Is that the first thing you kind of go to?
I sort of look at there's the four pillars, and I call it the four pillars. The first thing, of course, hormones. It's a hormone clinic,
Hmm.
so when we look at hormones, we look at the symphony of hormones. We're not going to just look at estrogen, progesterone,
Yeah.
because all these hormones talk to each other, and we have to know how they work. So looking at their hormones, certainly, sleep quality and quantity is really
Mhm.
important too, because when
Yeah.
you sleep your hormone axis changes, your neurotransmitters change. When you sleep, your immune system changes. And then I also look at, their mood and how are they manifesting their stress load, right?
Mhm.
Because their mood is a good barometer of what's going on. Is it
Yeah.
chronic anxiety? Is it depression? So that's called quality of life, energy and mood. And their diet is so important. You know, you take your dog to the vet, and the first thing the vet will ask, well, what does your dog eat?
Mhm.
Do we
Yeah.
ever ask that to our patients, right? And
No,
what kind of
no,
food?
which is so
And so
crazy.
it's so
So
important.
crazy. Yeah.
Yeah, because if you
Yeah.
look at all the ultra processed foods and the chemicals that we're getting in our diet, you know, a lot of it is inflammatory. So it's important. Those are the four things that I would say that I look at in detail. And of course, then we use diagnostics and backup labs and urine and ultrasounds if we need it or
Yeah.
whatever else we need to corroborate what we found with the symptoms.
I love that. And within that too, I mean, I'm sure most women coming in, are most women kind of midlife, or do you get a lot of younger women as well, or like all gamuts?
You know, I would say the majority is between the ages of 45 to 55. That's the
Yeah.
majority, but I see a lot of women in their 30s have hit early menopause, for example, just so stressed
Really?
out, their ovaries have shut down. Or I see young women with really heavy periods or painful periods, endometriosis that's never been diagnosed.
Yeah.
Just had a 30-year-old in the other day. She thought it was normal that, you know, you're
Oh
supposed to miss
no.
4 or 5 days of work every month. She said, I've been missing school and work for 10 years, 15 years, ever since she had started her period. And she thought it was normal. And I said, no, have you never been investigated? She said, no. And she said, isn't it normal that you take naproxen and you take pill? You know, I said, no. But
Yeah.
a lot of women who've lived with these symptoms
Yeah.
normalize it. So we see all the ones when the ovary is dysfunctioning.
Hmm.
So we see all like polycystic ovaries. We'll
Yeah.
see women early menopause, late menopause, two heavy periods, no period. So
Yeah.
anything that can go wrong with periods and hormones,
Yeah.
we probably see it.
Well, and especially if you, I mean, if you're younger having horrible PMS and horrible periods, you really want to, and this is what I talk about too. I'm like, you're in your 20s and 30s, you should not be having really hard, crappy periods. That's not the way it should be, because that's also going to translate
Oh.
possibly to a really tough transition from perimenopause to menopause. Do you think that would be something you see in your studies or in your clinic
In my
as well?
research, you know, when I
Yeah.
was doing the ovaries, the owner's manual research, there was so much research because you had to look at endocrinology from the gynecologist point of view, but you had to look at all the other hormones,
Mhm.
thyroid, cortisol, insulin resistance is a big one, right?
Yes.
All the hormones impact. But the ovaries are so disregarded. We don't even think of them. They're tiny little things that sit there. We have so much information on breast cancer now, right? And
Mhm.
awareness about breast cancer. But who produces the hormones for that breast cancer? The ovaries. And so the more and more research and the deeper I dug into the ovarian function, my God, these are your engines and
Mhm.
they are directly linked to your nervous system and they are triple supplied with blood from like, so everything you eat has to go through the ovarian um,
Wow.
blood supply. So
Mhm.
that really makes you think about endocrine disruptors, phthalates, you
Mhm.
know, all of
Yeah.
these chemicals in our diet,
Yeah.
and that goes through the ovaries and stress. So that makes you think then, okay, if my ovaries are not functioning, they're not well regulated, I'm going to have heavy periods or severe PMS, all of the other symptoms. We can't just isolate the estrogen progesterone. We have to look at everything. We have to
Yeah.
look at the body as a whole.
Well, I mean, what the stats I read was 8 out of 10 women are severely stressed, and a lot of women, I mean, when we think about just even the world today, it's so heavy right now. There's a lot of heaviness
There's a
right now. And
lot of
just
stuff
every
going
time,
on. Yeah.
man, every time I
Yeah.
open my social media, I'm like, oh my God, this is really tragic, everything that's happening.
I
And then you
know.
just think of our own little micro worlds of, especially women do so much. I mean, and even if you have a really supportive partner, I don't think it's
Mhm.
very often that a man's laying in bed at night going, oh God, we're out of toilet paper. And did I sign that document for the kids thing tomorrow? And oh my God, what are we going to do for lunch? Like, do you know, we're just kind of always going, right? We really carry so much. And I think we don't acknowledge that sometimes. And so,
It's that invisible load that women carry,
yeah,
right? Because we are
yeah,
by nature biologically
yeah,
hardwired to be nurturers and caregivers. So when things are wrong, our radars are on in the environment thinking, oh, this isn't safe. This isn't good. I have to fix this. I have to fix
yeah,
that. And so much of it is out of our control. So our brains think differently than male brains. There is a biological difference, and women take a lot of responsibility on themselves.
yeah.
And yeah, and it
Well, and
manifests
in
as
that,
symptoms.
And I
Yeah.
guess, especially you probably would see a lot of perimenopause, menopause women because of obviously that hormonal change. But I think that's when women for the first time, maybe if they had PMS, that wasn't a big deal. But all of a sudden, there's this, the hormones really shift. All of a sudden, your progesterone starts going down, your estrogen starts going all over the place, and you're not sleeping, your anxiety's picking up, and you don't feel like yourself, and you're gaining weight. And that's when I think women are like, wait a second,
Wait a
something's
second.
going
This
on.
this is
What's
yeah,
happening?
this
You
could it
know?
be my hormones? Should I
Yeah,
connect the dots here? And it's funny you say about PMS. Everyone gets a little bit of PMS
yeah,
and you estrogen dips, okay, yeah, you get some
yeah.
cravings, you get mood changes, but when it escalates, it's so intrusive to the family, right? That
Hmm.
person suffers subjectively, but then objectively, everyone around her. I've had husbands call our clinic and say, I think you need to see my wife because 2 weeks out of the month, she's like Dr. Jekyll and Hyde,
Yeah.
and she's either suicidal or ready to kill someone. It's that extreme. So when
Yeah.
PMS escalates to that level, you then understand how important our hormones are for the
Hmm.
neurotransmitters in the brain, because estrogen,
Yeah.
progesterone do modulate your neurotransmitters as well.
Wow. And so for perimenopause and menopause, what do you think is some of the, do you have the biggest myths that you see in your practice?
Yeah, there's a lot of myth busting that we have to
Hmm.
do, and one of the myths is that menopause is just hot flashes. So if you get hot flashes, then you must be in menopause, and it's not just hot flashes. That's just one tip of the iceberg. There's so much more. There's the anxiety, the brain fog, the insomnia, the vaginal dryness, the weight changes, and even a loss of confidence sometimes
Hmm.
too. So cognitive things, they say, "Oh my gosh, I better not tell my boss, but I'm getting really forgetful."
Yeah.
You hear women
Yeah.
at top level positions afraid to show their vulnerability because now all of a sudden their brain capacity is not predictable. And so who would have thought to connect the dots, all of that? Could it be the big wild swings in my hormones? So that's one of the myth busting is creating awareness around their symptoms.
Hmm.
And then the other one is that, the women think that they should not be getting treatment until they stop having periods.
Hmm.
And that's not the case.
Yeah.
Why would you suffer for 8 to 10 years before your
Yeah.
last menstrual period? Even during perimenopause, there are so many things you can do, you
Oh,
know, ranging from diet
hmm.
and lifestyle intervention to even just progesterone in the last 2 weeks. There's so
Yeah.
much that you can do. So have the conversations, bring it up,
Yeah.
advocate for yourself, and get the answers.
Yeah, I kind of, talking about having the menopausal plan, and I always say, I'm like, um, you wouldn't walk into the doctor 9 months pregnant and say, "What are we doing with this? Am I coming to your place? Are you coming to my house? What's happening?" Like the minute we find out we're pregnant, we're, for the most part,
Yeah.
most women are like, "I had a birthing ball and a CD and pictures," and
Yeah.
I was like, I was that person, And I say you need to take the same amount of care as you would as preparing for your baby, as preparing for your aging. And it
Oh,
is so key, right? So,
absolutely. It's that book. Remember what to expect when you're expecting. So you
yeah,
go in fully prepared for pregnancy.
yes, yes.
So this is what the ovaries manual is about. The ovaries
Love
owners
that.
manual is
Okay.
about so women can learn what is this all about? Because our
Yeah,
biology is so different than men.
yeah,
And so we have to recognize, men and women are equal, but we are different. Let's face it.
yeah.
And so that biological differences, we have learned to normalize and just suffer with through a lot of it. And now we know, there are ways to have a better quality of life and have a seat at the table and be equal. You can close the gender gap hormonally by
Yeah,
understanding hormones. That's
yes.
where I come in. And when it comes to hormone therapy, to your earlier question about menopause, it's finding the right person,
Mm,
the right timing, the right
mhm.
type of hormones for the right duration. So the rightness is very individualized, and most women can come in somewhere on their journey and figure out what's right for them if they have that discussion.
You must have a lot of women coming in upset and feeling like they missed the boat, right?
Yeah.
That, yeah,
Oh, we're
right? Who
getting a
felt
lot
like,
of them now,
right? I can
especially
imagine.
now.
Oh, I can
Yeah.
imagine. They're like, "Can I go on now? And why wasn't I told?" And if a woman is having, because there's so many women I meet who, have are sometimes 10, 15 years past
Yeah.
like menopause, and they still are still in menopause, but the actual year passed, and they're still experiencing hot flashes or symptoms. Now, is that something? I know there's lots of research happening. Is that something women could still go on? I know there was like a 5 year
Yeah.
time
There,
period at
there,
one
there,
time.
there is a, okay, so right now there's so much noise out there about
Yeah,
menopause. A
so
lot of
much
women,
noise.
75-year-old came in the other day and she said, you know what? I was on hormones. I was on the right stuff. She'd come to our clinic years ago, but then she got scared. She said, I'm on hormones. She went
Oh,
off. Can I restart? Was her question. And I said, you know what? It's been, 15 years. You stopped them. And now if I introduce estrogen to you, we're waking up cell tissue that hasn't been stimulated in
yeah.
your breast, in your uterus. So you have to be really careful
Hmm.
if there's been a long hiatus away, and if you're what we call hormone naive, you've never been introduced to hormones, you have to be careful. New data is coming out now, though, that
Hmm.
if the woman has had clear mammograms, she's a low risk for breast cancer, she's a low risk for blood clots. Maybe introducing transdermal low dose estrogen might be okay for that individual
Okay.
for blood pressure's normal. So again, it goes back to the individual. Now, vaginal estrogen, anybody can take
Everybody should, like,
anytime.
yeah, yeah.
Everybody, 90 year
Everybody
old,
should
I have
have
an
it.
85-year-old. So the vaginal estrogen is very different. I'm talking about systemic estrogen.
Yeah.
The other point we should make is that if they don't qualify for estrogen and progesterone, for example, and they're now 60 or 70 years old, and they say, I missed the boat. Well, there are other options. There are
Hmm.
other things. And through functional medicine and
Yes.
integrative medicine and International Hormone Society, they're looking at other things like DHEA,
Yeah.
compounded pregnenolone. So those are things that are very, very, if you've been trained and had the advanced knowledge about
Yeah.
those are other things that you can use if there are no contraindications. Just
Okay.
so your listeners know, there's
Yeah.
always an option
That's
to
good to know.
optimize. Yeah.
That's good to know. And can you explain to everybody, because what is, so vaginal estrogen, obviously I believe every woman should probably be using vaginal estrogen, but can you explain
Yeah.
why women don't need to be fearful of it? If they don't want to go on hormones, let's say a woman has a chronic UTI, she's doing D-mannose and cranberry like crazy, it's not
Yeah.
going away, but
Yeah.
she's scared to try vaginal estrogen because she thinks it's going to be a hormone, it's going to shift her body. Can you explain what that is and why she doesn't need to be worried?
Okay, so for most women, vaginal estrogen is absolutely safe
Okay.
because when you apply it topically, either in a gel or a cream or a tablet or a little, you can even get a ring, or there's so
Mhm.
many ways to get the estrogen into the vagina. Most of it stays localized to the bladder and the vulva, the outside of the
Mhm.
vagina. You can pick up a little small bit in the blood, but it's non-negligible. It's not
Okay.
enough to have effect on your bones, for example, or your
Okay.
brain, but it
Yeah.
is going to be very effective for down there. The only women that it's contraindicated in, if you have vaginal bleeding and you're 60 years old and you don't know why,
Okay.
don't use vaginal
Yeah.
estrogen.
Yeah.
If you've had breast cancer that was estrogen dependent and now you're on drugs to suppress your estrogen,
Yeah.
then those women you have to be a little bit more careful. But there are other options. There's a brand new drug called Interosa, for example.
Amazing.
That one's safe for breast cancer. The point is, we have so many options and
I know.
choices now that we didn't have. So
Yeah.
to be a menopausal woman at any age now, just know that there are options. Have those conversations with your
Yeah.
practitioner.
Yes. Okay. You are certified in mind body medicine through Harvard, which is so impressive. And we already talked about chronic stress and how that emotionally load can show up hormonally. Now, you believe that it is through through cortisol, and then also it's going to lead to higher levels of estrogen that can throw off estrogen imbalance, correct? So if
Yeah.
somebody so if somebody is doing everything right, so
Mhm.
that they're doing the eating well, the exercising, they still feel exhausted, what is that missing piece of nervous system regulation?
Yeah, that's a great question, Erin, because I have women who are meticulous. They're those women who've accomplished everything, disciplined, they've got their schedules. And when I tell them, your cortisol pathways are still not working, they've spent thousands of dollars on the best supplements, and they've got this, wonderful meditation yoga practice. And I say, you're wasting all this time and resources because when your nervous system is in hyper, what we call fight or flight or sympathetic
Mhm.
nervous system overdrive, guess what happens? Think about it. You're running away from a dinosaur, so your nervous system is designed to be very efficient. So if you're in fight or flight, the whole blood supply that goes to your gut is now going to your muscles. You're not rest and digest is the opposite of fight or flight.
Yeah.
So when you're in rest and digest mode, your blood flow is going, your secretions are working, your motility is working, your gut is your second brain. And
Mhm.
your brain, second brain, is now ready to digest fully.
Mhm.
But when you're living in fight or flight all the time, we notice that women don't absorb their nutrients as well. They have more problems with heartburn or irritable bowel syndrome and all kinds of gut symptoms. And 85% of our immune system is actually found in the gut, and
Mhm.
70 to 80% of our serotonin is manufactured in the gut. So the gut-brain connection is extremely profound, and we don't, in conventional medicine, um, we don't really look at it.
No, we don't at
And
all.
it's quite sad. So, yes, the cortisol connection to hormones directly for progesterone is something that I had to discover, and it wasn't something I learned in medical school. It
Yeah.
was through further research that when women are highly stressed, they're more prone to get polycystic ovaries, more
Mhm.
insulin resistance. When you produce cortisol, your ovaries pick up on that and say, not a good time to breed, not a good time.
Yeah.
Let's shut everything down and then send all our progesterone to make cortisol because
Yeah.
this person is trying to run away from a dinosaur. That's the message.
Yeah.
And so your ovaries shut down when there's a lot of cortisol because they're trying to say, let's not create any room for reproduction right now. Let's just send all our forces to fight. And that goes into cortisol. That's called the progesterone steal
Yeah. The
syndrome.
progesterone steal.
Yeah, yeah.
Well, especially think
So
about, I mean, I said this last night even. I said, if you are in middle life and your progesterone's already going down and you are super stressed, and then then that progesterone you want so badly,
I
and your
know that's the
cortisol is
thing.
then that's take, and then you're completely messed up. You're no wonder you don't feel like yourself anymore.
And we should have just a little basic introduction to estrogen and progesterone, I guess,
Yeah.
just for your listeners. Like, think of estrogen as the fertilizer, right?
Hmm.
It makes everything grow, it makes your breast tissue grow, the uterus lining grow. In the brain, estrogen helps you to be less depressed. It helps with memory, it helps synapses and neurons to grow. So, it's a growth hormone in the brain. Progesterone is the lawnmower. It comes in and tells your uterus, okay, enough lining, you need to shed, enough
Hmm.
breast growth, you need to stop. And then it goes in the brain and it says, okay, enough excitability, let's calm things down. It's a very calming hormone. So it
Yeah.
helps you with sleep and staying clear. And so when estrogen and progesterone balance are working well and the receptors are receiving and everything's going great, the woman, goes through her natural periods and usually she goes through that just fine. When the balances shift and you have low progesterone or too much estrogen, that's when you can get symptoms as well.
Yeah.
So at menopause, it's different because both of them crash, right? They
Yeah.
fall off a cliff. But during perimenopause, it's really important to know that the balance of estrogen progesterone ratio, the EP ratio, is very important. And the way to do it is through diet, lifestyle,
Yeah.
stress, all of those things that we talked
Yeah.
about.
Well,
Yeah.
cruciferous vegetable. I mean, I'm big on
Yeah.
nutrition, right? So we
Yes.
always, and I am notorious for buying beautiful vegetables and putting them in my fridge and they go bad. So they look beautiful. So I'm really big on frozen vegetables. I buy a lot of frozen vegetables. So I know
Yeah.
for a fact that like I have broccoli I just made tonight. I'll put that in the fridge. I'll put cauliflower. I'm constantly cooking cruciferous vegetables because I know the benefits that does for my body and also hormonally as well, right?
Yeah, and just for your listeners, a lot of them think, well, what's in it? There's a chemical inside cauliflower,
Yeah.
and you've probably researched the indole
Yeah.
3 carbinol,
Yep.
which helps with estrogen metabolism. right?
Yeah.
So it helps your liver, which is the responsible organ for
Hmm.
detoxifying all your estrogen. When you break down your estrogen properly and you have enough cruciferous vegetables and B vitamins, you actually make good products, byproducts of
Hmm.
estrogen. But
Yeah.
when your liver is not well supported, then you're making products, byproducts of your estrogen that can actually be inflammatory. So
Yeah.
that's why it's really important for your listeners to know the why. And when we
Yeah.
understand the why, then, oh, okay, well, I better pile on some more
Yeah.
broccoli here. Yeah.
Right. The more broccoli, the better.
Yeah.
So I want to talk a little bit about the Mind Body Cure book. So it resonated globally. What are
Hmm.
one or two simple mind body tools women can start using right now to support hormonal balance?
Well, the first, I would say, piece of information is recognizing that we all have a nervous system.
Hmm.
This nervous system is running in the background all the time. It's what's making your heart beat, it's making your gut move, it's making you breathe. So we have three brains below our main thinking brain. We have the heart brain, the gut brain, the lung brain. And so that's through our vagus nerve. So what can we do? Because it's running automatically, but do we have any control over it? And this is what the research at Harvard taught me, and working with a cardiologist there, Dr. Benson, that we actually do exercise some control over our nervous system. And that's through breath work. So when you inhale through your nose, and we can practice this inhale, and you hold it in for about 5 seconds, and then breathe out, exhale. And when you exhale, make it longer than your inhale. What you've just done is engage the vagus nerve. And if I had the lab work right in front of me and all the equipment, I would see that now, after 5 or 6 breaths, Erin's heart rate just dropped just through breath
Interesting.
alone. Her blood pressure went down. Then I'll
Yeah.
measure your brain waves and I'll see your brain waves actually change. Instead of going the
Mm.
crazy electrical big waves in your brain that push on your adrenal to make more cortisol, the brain waves change electrically. So you've got a biological, chemical, and electrical change that's happening. And then when we measure the hormones, your cortisol levels drop, your serotonin goes up, your oxygen goes up. That's the drug of choice, is oxygen.
Yeah. Yeah.
So through breath work alone and the TED Talk, if you
Yeah.
had a chance to look at
Yeah.
it, I just said, okay, this is very complicated topic, the nervous system. They said, well, why don't we think of it as BMW, breath, mind, and word. So you do
Mm.
your breathing, you put your attention, your mind's attention on your breath, and you say a word as you're exhaling. So breath, mind, and word. And within a few minutes, you now
That's
have
great.
the internal locus of control, and all of a sudden, you can't control what's going on with the
No.
politics out there. You
No.
can't change any of that. What you can control is how
Hmm.
you show up. So you become more responsive and less reactive. And that, in a nutshell, is the BMW response.
I
And
love that.
then, if you want to go deeper, of course, you can be more mindful and have your
Mhm.
attention, wherever your attention goes, energy flows. So
Yeah.
have your
100%.
attention on things that serve your nervous system and not go against it. Always be present.
Yeah.
And you can't turn on stress when you're present.
That's very true because you're okay right now.
Exactly. In
Stress
this
is usually
moment,
over
you're
there
safe.
or back
You're
there.
safe. Yeah,
Right now, we're good. I know with Aaron Wellness, we have 5 pillars, and the first pillar is the thoughts you think. And that's
exactly.
really, to me, because that is the cornerstone of health and wellness. That chatter that goes on, that negative little girl inside that lives there that can very easily tailspin you. Really important we catch ourselves and we can live in gratitude. And even in moments, the other day I had to kind of do it. I'm like, I'm grateful for the CR. I'm collecting money because it means I have a good business.
Yeah.
Like trying to be grateful
I'm
about things.
trying
And
to
you're like, oh my
reframe. That's
gosh,
that's a very
reframe it,
powerful
right?
tool, yeah, that
It's
I
like,
talk about.
yay,
Yeah, that's
thank you.
fantastic.
Right. So it's things like
Yeah.
that,
So
being
you
able to
you
look.
have that as your first pillar, and
That's the
I'm
first
so
pillar. Yeah.
impressed. Yeah,
Yeah.
that
So
that's
it's the
so powerful.
thoughts you think, the friends you keep, daily movement, nutrition, and lastly, supplementation, because supplementation is there to supplement you.
Yes.
I always say, no, I don't have a magic pill. The only magic pill I have is boric acid, which I think is pretty magic because it works pretty fast. But that's it. Everything else takes all of this holistic, which all the things together to really, you have to put the work in.
You
You
know,
have to put the work
as a
in.
physician, I learn so much through my patients, and I'm a
Yeah.
curious person by nature, and I
Hmm.
think the day I stop learning is the day I'll die. But I always learn something new and research. And with the supplements in medical school, we were just taught to tell our patients, you don't need supplements, you don't need supplements. But what I know to be true now is that, for example, vitamin D. You'd have to lie buck naked for hours and hours in the sun. We don't have sun here.
Yeah.
And it lies
Just
for
be
hours just
lying
to get
naked
enough vitamin
outside.
D. So you need to have vitamin D. You need to have
Yeah.
magnesium. You need to have some
Yes.
omega-3. And maybe if you're over 45, 50 and stressed, take some B vitamins. And
Hmm.
maybe if you're trying to build muscle, some creatine or
The
collagen. And
creatine. Yeah.
so you have to know what your body needs. And if you're
Yeah.
not getting it, then providing those building blocks so you can optimize your body function,
Hmm.
it makes sense.
Yeah,
Yeah,
exactly. And you're going to get the results you want. Like the
that's
supplements will
right.
do their job if you're actually doing your job. And I think
Your
we're in a
job.
culture where everybody wants results so fast, and if it's like I have Water Be Gone, for example, and it helps shed water. It's one of my best selling
Yeah.
products because
Oh,
you see an immediate result. So people are like, it
mhm.
works. But the other
Yeah.
ones, sometimes they take a while. They can take up to 30, 90, 60 days to really start reaping the benefits. And sometimes you don't know until you come off. Then you're like, oh, that's
Oh,
why I
now
don't
I
feel
see it.
as good, right? So
Yeah.
it's kind of an interesting time because people want that immediate gratification. But I've also said, you don't, if you go to a doctor, your doctor's not going to a weekend program and being certified as a doctor. You know what I mean? Your
No,
doctor went to years and did the work and they've come out with their degree. Like that's what it takes to life is hard and life is work. And if you want to get the most out of it, you have to be willing to commit to yourself to recognize you're worth it to work on.
absolutely. And
So
often we see broken carts that took years and years and years to create, right? And we see them and now they're in bad shape. They've got
yeah,
autoimmune disease, they're going through menopause, they've got all the symptoms.
yeah,
So it's unrealistic to expect that, okay, now within a week of taking this supplement or this
100%.
medication, I'm going to be suddenly better. If it took years and years to crash, it's not going to take just a week
Hmm.
to rebuild, right? So
Yeah,
it takes time, but consistency,
is
having,
everything.
when you do your breath work, the BMW,
Hmm.
it's a way to focus and create intention too. And
Yeah.
when people create these repetitive, healthy habits every day, then you
Hmm.
see the benefits because I see the 90-year-olds that are still
Yeah.
moving and walking. Today I met an 85-year-old who was walking on the road outside and she started chatting and she said, rain or shine, I just go for a
Hmm.
walk. I just
Yeah.
keep moving. And
Yeah.
having habits that build
Yeah.
like build your resilience, that's
Yeah.
the way to go.
That's
Yeah,
100% the way to go. We don't want to just age. We want to age powerfully. That's a really big thing, right? We want
exactly.
to be. My mom and my dad. So my mom and dad broke up in their 40s. My mom went back to university, got 2 degrees,
Yeah.
remarried, took care of her health. My dad did the complete opposite. My dad's only 74. He's in long-term care facility now dealing with dementia. There was alcohol, drugs. He made very poor decisions, isolated himself, very antisocial. My mom is thriving, like
See,
thriving at 75. She is a lifelong learner, constantly taking courses and classes. She
yeah.
just started taking tap dancing. And I'm like, because she's always wanted to take
Fabulous.
it since she was a
Love it.
little
You
girl,
have good genes,
right?
Aaron.
Right.
You
So
have
I look
great
at that
genes
as an
on your mom's side.
example. And I'm
Yeah.
like, she is a clear demonstration to how I want to be when I'm age. And I also have
Oh,
somebody who I look at and I'm like, I don't want to be like that. I don't
yeah.
want to make, and right now, especially when midlife, and I think that's why women come into the clinic too, it's like, it's game time. This is really important time. You're laying the groundwork for how you want to be 70s and 80s. And yeah,
Exactly.
it's
And
just so
I think
important.
women's health too has changed, Erin. You would
Hmm.
agree probably that it was on the back burner for so many decades, but
Yeah,
now, we've got the data. We're finally doing gender specific data because all the drugs that we've had were never tested in women, as you know,
yeah,
hypertensive, cholesterol. But our liver is different, our heart is different, anatomically we're different. And so drugs move through our body differently. Our brains are different. So I think knowing that, the research is very compelling. We were scared to test on women, to be quite frank, right? In case they got pregnant or because there was
okay.
so much variability with the period. But now you're going to see a lot more gender
It's so
specific
exciting.
women's health research coming out, which is very exciting. It's a
It's
great
really
time to be a
exciting.
woman, I say. Yeah.
Great time to be a woman. So your
Yeah.
upcoming book, Ovaries, the Owner's Manual.
Mhm.
Well, I kind of know what inspired it because obviously you've realized the ovaries are these amazing part we have in our
Amazing
body that we need
nuggets
to be
are
looking
little
at, right?
nuggets. Yeah.
And so it's launching in, is it the fall next year is what we're looking at for that one?
I
So
think
people can keep their eye
realistically
out.
it'll be fall, but there's
Okay.
always, yeah. So I
Yeah.
can't give you a
It's like a
final date. I'll
renovation of a
keep you
house.
posted though. Yeah,
It's like
I
the
will keep
renovation
you
of a
posted.
house. It's like 6 months, and
Exactly.
you're like a year later. So, what do you hope women take away from this book?
My whole passion has been for advocacy, education,
Hmm.
and empowerment. And
Yeah.
so if they start to learn, and I'm hoping to reach the younger women, right?
Hmm.
Menopause women are ready to hear, they're ready to change. They've now raised their kids. But really, if you want to do the work and have good ovaries,
Yeah.
through perimenopause, we got to start early. So, a
100%.
lot of the educational initiatives that I'm going to do with this book are going to be through high school students as well.
Love that.
Because if we can get young women to learn, listen, we got to protect our little ovaries because, smoking, vaping, binge drinking, they're
Hmm.
not told that it's affecting their ovaries.
Yeah.
They're not told that later on you're going to have more problems in perimenopause and menopause. You're going to have trouble with fertility. No one
Hmm.
tells you that, right?
Yeah.
So if they understood the impact of their decisions in their young life, or if they're suffering, they don't have to suffer in silence. So
Yeah.
it's a big educational awareness that there's no shame around having heavy periods. There's no shame around saying that you have so much pain. You don't have to suck it up. So it's just giving permission for women to understand their biology. That's the
Yeah.
impact I want to make.
I love that. It was a little quick story was funny. The other day, Michaela is 17,
Yeah.
and she was going from her, bathroom to her bedroom, kind of storming across, and she's like, "Oh, I hate it when I'm in my luteal phase. I always feel so puffy and like don't feel like myself." And she goes into her room, and I was like, "Oh, she knows what a
Oh
luteal phase
gosh.
is." Like, I
She
love
knew.
this. Like, I'm
Oh,
like, I
she's
love the fact you know that. That is like so cool because I never would have said. I didn't know luteal when I was 17. I'm like, you must be listening to all the talks when you're demoing in the back. I just love
good
the
for
fact that she
you.
knows that. I just thought that was so funny. I'm like, love that girl. And I know she tells her, I always talk to her friends too about their periods and stuff. And she's always like, Mom,
Yeah.
enough,
Oh my
you
goodness.
know?
Yeah.
But I
But
love the fact, yeah,
good that you're having those open conversations, right?
yeah,
Can you even imagine a time, say
no,
30 years ago, like they would not be able to say the word period on a sitcom, like a
you're right.
Friends sitcom, they had to delete an episode because the word period came up. So
Oh my
this
God,
is
it's
how
so
far we've
crazy.
come that now we're
So
having
crazy.
these conversations, and women should say this is just biology. Like we
Yeah,
have to understand biology and it's different than men. That's all. Yeah.
that's so great. So, what do you hope women stop doing when it comes to their health? It's the last question. And what do you hope they start doing instead? We
Um,
can even go for the younger girls. Actually, we could start even with
yeah,
the younger because we just kind of talked a little bit about the book. So, if somebody in their younger years, what do you hope that they stop doing, and what do you hope they start doing?
I think for the younger women, um, stop ignoring your symptoms and normalizing them, and
Hmm.
stop having this feeling that you have to push through. Suck it up, cupcake is the
Yeah,
thing, and we don't have to. Let's challenge that belief. Why do we have to?
yeah,
So we shouldn't normalize suffering, and we shouldn't have any shame around what is natural and biological. So I wish they would stop normalizing suffering and shame. It doesn't have to be. What can they start doing? Um, Listen to their bodies, learn to connect the dots, ask the questions. Now we're in this information age. We have
yeah,
information everywhere, but make sure they're getting good, credible information from good sources, and treat health not like this little window, okay, I'm going to go on this crash diet. Your health is a long-term relationship. So what's your long-term relationship with health? So we
yeah,
have all these relationships in life, right? And
yeah,
we have friends, and I'm glad that you have this friends to keep because friends are important.
yeah,
Your relationship with your kids, but your relationship with your health is equal to your future wealth. Because if you don't
yes.
have your health, you're not going to
You
have.
don't have
Yeah.
anything. Yeah, 100%. I love that. Okay, I've got some rapid fire questions. You
Mhm.
are a foodie, you told me
I
earlier, so I
am.
like that. What's your favorite, what's your go-to comfort food or treat?
Well, for my treat, I go for nuts, pistachios. Love them. And for
Oh,
food, love healing bone broth or soups.
Ah,
That's my
look at
food.
you, all
Yeah.
healthy. Okay, so what's your favorite swear word? You can say it if
I
you
got to
like.
keep it podcast friendly, don't I? Well,
Yeah, okay.
I grew up on the East Coast. I grew up in Newfoundland, and
Oh, did you
so
really? I didn't know
yeah,
that.
I
Oh,
look like a
wow.
typical Newfoundlander. Yeah, my
Yeah,
father
you look like a
immigrated
newfie.
here.
It was the first
Yeah,
thing
there
I
you go.
thought. She's a newfie. Oh, that's so funny. Okay.
And yeah, so I did my pharmacy and med school in Newfoundland, but frickin' is just something I use a lot, but not saying the actual F word.
Okay,
Yeah.
the F bomb, the F bomb. Is there a book, podcast, or practice that's inspiring you right now?
I read a lot and research a lot, but I would have to say my go-to is Peter Attia. I love his
Oh,
balanced
he's so
approach.
great. Yeah,
Outlive the
he's
book.
great.
I know it off by heart.
Yeah.
And the new research that I'm loving that he's not doing yet, but functional medicine is
Mhm.
looking at your nervous system, which I've researched thoroughly, and then now looking at the immune system because we're using biologics for almost every disease, including cancer now. So
Yeah,
there's a huge immune component. So I'm going to look at the interplay between the
love
nervous
that.
system and the immune. Yeah.
I love that. And what is one thing you tell your 20-year-old self?
Oh boy. I would say uh rest is productive because I grew up with
Hmm.
don't sit idle. You never sit idle.
Yeah.
Rest is productive and boundaries are medicine for women.
Hmm.
Boundaries are absolutely medical, medical
Love that.
interventions. Yeah.
Love that. I'm getting better at boundaries. Love that. Okay, well, I want to thank you so much for your time today. This has been so insightful. I could actually probably sit here and keep asking you questions for the next couple hours.
No, it was
But
great
where,
chatting. It felt like a chat,
oh, this
so it was
was great.
great.
So, where can listeners find you and learn from you and access some of your research and books and whatnot? Where do they go to?
Well, I have the website,
Yeah.
drbalpawa.com, West Coast Women's Clinic. We always have
Okay.
great resources and learning for every stage of their journey. Then when my book comes out, I'll have that on the website. I always post things
Okay.
on my blogs on the website. So
Okay.
books,
Well,
yeah,
we will put all of the
I'll
links to
send it.
find you. Thank you so much, Dr. Powell. I really, really appreciate your time today. And thank you for what you're doing for women. I mean, it's just
Oh,
incredible. You have such an
and
incredible
I have a
clinic.
mutual respect for you as well.
Thank
You're
you.
doing the same thing, and I love that you're
Okay.
advocating for wellness. Thank you.
Thank
And
you. All
thank you for
right.
having me. All right, take
Well,
care.
thank you everybody for listening and stay tuned for next month's Friends You Keep. Hey, wait, before you go, we would love to extend a special offer, a 20% off of any of our Health Canada approved, third-party tested, all-natural support supplements. Simply head over to erinwellness.com and enter the code ERIN20 and take advantage of our gift to you.